lots of different types of work experience that can be useful when applying to medicine, the most obvious one being clinical work experience. This might be within a GP practice or a hospital. Clinical work experience, however, isn't always possible to come by, so what else could be considered useful work experience? It could be a part-time job alongside your studies, experience within a caring environment, volunteer opportunities within the local community, working with people who have a disability, or even experience with young people and the elderly. The key thing to remember with experience is it's not necessarily about how much experience you have or whether it's clinical or non-clinical. It's about how you use it. Medical schools are not looking for a checklist. They want to know what you've learned or gained from that experience and for you to be able to talk about it. So why is it actually useful to have work experience? Firstly, having work experience is a really good way of making sure that medicine is the right course for you. We want doctors who can communicate effectively, work well within a team, are empathetic and able to think critically. These are key skills and qualities that you can develop from your work experience. If you haven't already, it may also be a good idea to have a look at the NHS Constitution and core values. If you have some clinical or caring work experience, it can also provide you with a realistic understanding of the profession. What we mean by this is that you can recognise and understand that there are challenges, emotionally, mentally and physically, of being a doctor and working within the NHS. Work experience is also something that medical schools will look at as part of the selection process. This could be as part of your personal statement and during the interview process. There are no rules as to what type of work experience you should have, but remember, medical schools are looking for key attributes and skills that would make a good future doctor. Whatever kind of work experience you have, try to make sure that it's also recent. If you're unable to get any clinical work experience, there are some useful online clinical work experience resources that you can still access. Observe GP. This is provided by the Royal College of General Practitioners. Virtual work experience. This is provided by the Brighton Sussex Medical School. A patient journey. This is provided by the General Medical Council. Whatever work experience you have, you want to make sure that you're making the most of that opportunity. A reflection diary is a really good place to start. This is an opportunity to record what you've seen or experienced, your thoughts on this, and how you might apply your learning or new knowledge in the future. The RCGP, or the Royal College of General Practitioners, has a really helpful diary which you might find useful to structure your reflection. Also, have more than one example to choose from and be specific in your examples. You might also want to start thinking about how these examples align to the NHS Constitution. When did you work together as part of a team? Can you talk about a time that you've made sure people are treated with respect? Did you make sure that everyone is counted and treated equally? Can you give an example of this? When have you shown compassion or empathy? Can you talk about a time when you've done your best to make sure that something has gone as well as it could have? Whatever you're reflecting on, you should always be specific and targeted in your approach. Capture the details of your experience before you forget them. You should be honest about what was good and also what was bad. Think about different perspectives. In other words, put yourself in the other person's shoes. What have you learned from this experience? Why does this matter to you and for becoming a doctor?